Hello everyone. Welcome back to the Quick Fact segment of Med-Surg Mentor. Cardiac auscultation refers to listening to the sounds of the heart with a stethoscope. Today, let's see which are the auscultatory areas of the heart. The 5 critical auscultation points or cardiac landmarks are aortic area, pulmonic area, Erb's point, tricuspid area, and mitral area. Aortic point or aortic area is located on the right side of the sternum in the second intercostal space. Likewise, the pulmonic area is left to the sternum in the second intercostal space. The typical S2 sound can be heard at this point. Third point is Erb's point, and this is located to the left of the sternum in the third intercostal space. Tricuspid area is located at the left of the sternum in the fourth intercostal space close to the sternal border. And the last one is mitral area or apex. This is located at the left side of the sternum in the fifth intercostal space. This is the area where the clearest resonance of the S1 sound can be heard. Hope this short video was informative. Thanks for watching and please don't forget to subscribe to my channel. Thank you.